Okay, let's unpack this. Picture this. Your dog, totally normal, happy, playing around. Seems fine for a few days. And then maybe, they just seem a little off,
Yeah.
quieter. Or you spot a weird little bruise, maybe,
Uh-huh.
and you think, where did that come from? Then another day or two goes by, and boom, suddenly they're having trouble breathing. Maybe their gums look pale. It turns into this mad dash to the emergency vet.
Right. And you find out something really scary is happening internal. That whole progression, from seeming fine to suddenly critical days later. That's the really insidious part of anticoagulant rodenticide poisoning.
Insidious is the right word,
Yeah.
because it's not instant.
Exactly. That delay is what catches people and pets off guard. It's consistently one of the top toxicities we see in vet ERs. Dogs especially seem prone to finding this stuff.
And that hidden danger, that delayed reaction, that's exactly what we're getting into today. We've got these, well, pretty dense clinical guides, the kind written for specialists.
Yeah, the technical stuff.
Right. And our mission here is to basically translate them for you. We want to pull out the really critical bits so you understand what's actually happening inside your pet, what signs to look for, and crucially, when and what vets do to diagnose and treat it, and of course, how to try and stop it from happening in the first place. Think of it as your essential guide.
Exactly. These sources give us the why behind the emergency room visits, which is, vital.
So let's start at square one. How do these poisons actually work? What are they doing in the body?
Well, what's kind of fascinating and also pretty scary is how they mess with a totally normal, essential body process. These anticoagulant rodenticides, ARs for short, they kill rodents by stopping their blood from clotting.
Right, causing internal bleeding.
Precisely. But the problem is they do the exact same thing to any mammal that eats them. Dogs, cats, wildlife, us, potentially.
And it all boils down to vitamin K, doesn't it? I know vitamin K is essential for clotting.
Absolutely essential. You can't clot properly without it. Vitamin K is like a key ingredient. The body needs to make certain proteins functional specifically, clotting factors 2, 7, IX, and X. Think of them as the construction crew for blood clots.
Okay, so the body uses vitamin K to activate these factors. Does the vitamin K get used up then?
Well, normally no. The body's incredibly efficient. It has this recycling system. After active vitamin K does its job, it gets turned into an inactive form, vitamin K epoxide.
Right.
Then, this really important enzyme, vitamin K epoxide reductase, VKOR, let's call it, jumps in. Its whole job is to take that used inactive epoxide and change it back into active vitamin K.
So it can be used again.
Exactly. It's a continuous loop, vital for keeping the clotting factor production line running.
Okay, now here's where the poison enters the chat, right?
Mm.
This is the interesting, or rather the dangerous part. What do the rodenticides do to this VKOR enzyme?
They block it. Simple as that. The ARs essentially jam the gears of that VKOR enzyme. They shut down the recycling plant.
Ah, I see. So the body might have a little active vitamin K floating around initially,
Right, there's a small reserve.
but once that's used up making clotting factors, it hits a wall. It can't recycle the inactive form back into active vitamin K because the poison is blocking that VKR step.
You got it. And then what happens is the existing clotting factors, the ones already made, they naturally break down over time. They all have different lifespans, different half-lives.
Right.
As they degrade, the body just can't make new functional ones to replace them because the recycling pathway is blocked. So you get this gradual, progressive loss of clotting ability.
And that's the delay. It's not instant poison. It's a slow-motion failure of the clotting system as the existing factors run out.
That delay is the absolute key takeaway here. Factor 7, it has the shortest half-life, only about 6 hours or so in dogs.
Wow, short.
Yeah, so it gets depleted fastest.
Right.
That's why the first clotting test to go abnormal, the prothrombin time, or PT, usually changes within maybe 24 to 48 hours. It's very sensitive to factor 7 levels.
But the bleeding, the actual signs we see, that takes longer.
Right. Clinical signs, the actual bleeding problems, they typically don't show up until about 3 to 7 days after the animal actually ate the poison. That's how long it takes for enough of those factors to get used up and not replaced.
Man, so a dog could eat bait on Monday, look perfectly fine Tuesday, Wednesday, even Thursday, and then crash by Friday or the weekend.
That's the scenario. Exactly. It highlights why if you even suspect they got into something, you need to call the vet then, not wait for them to look sick.
Absolutely. Early intervention is key.
Yeah.
Okay, now you mentioned there are different kinds of these rodenticides. Are they all, like, equally bad?
No, not at all. And that's really important for treatment. They generally fall into two main camps: first generation anticoagulants, or FGRs, and second generation SGRs. People sometimes call the SGRs super warfarins.
Super warfarins, yeah, that sounds more
Gosh.
intense.
They are. FGARs, like warfarin itself or difacinone, they're generally less potent. They have shorter half-lives too. Warfarin's is maybe 15 hours in dogs. For a roadie to die, it often needs to eat the bait multiple times over several days.
Okay, less potent, shorter duration. What about the SGR, the super ones?
Yeah, the SGRs, things like brodifacoum, bromadiolone, difaciolone, these are much more potent. And critically, they have way longer half-lives. Broadfilm's half-life can be up to 6 days in rodents, and they can persist in the liver even longer in pets.
6 days, wow.
Yeah, so what that means is a single feeding can kill a rodent. And for our pets, a single ingestion, even a small one, can be extremely toxic and require a very long treatment period.
So less poison causes a bigger, longer-lasting problem with those SGRs.
Exactly. And that difference directly impacts treatment. Because SGRs stick around in the body so much longer, the antidote, vitamin K1, has to be given for way longer.
How much longer are we talking?
So for FGARs, you're typically looking at about 2 weeks of vitamin K1 therapy. But for SGRs, it's usually 3 to 4 weeks minimum, sometimes even longer, maybe 6 weeks, depending on the specific poison and how much they ate.
Wow. So stopping that vitamin K treatment too early with an SGR sounds like a huge mistake.
It's the biggest risk. It's the most common reason we see animals relapse and start bleeding again, often fatally, after they seem to be getting better. You absolutely cannot cut that treatment short.
Got it. Complete the full course. Now, I've seen those baits, the colorful blocks or pellets, bright green, blue, red. Can you tell what kind it is just by the color?
Yeah, they make them brightly colored, often green or blue, sometimes red, and they come as blocks, pellets, sometimes paste or meal baits. But unfortunately, no, the color isn't a reliable guide to the actual active ingredient inside or whether it's first or second generation. You really need the packaging to know for sure.
Always try to grab the box if you can find it.
Definitely. Huge help for the vet.
And weren't there some rule changes about selling some of these?
Yes, exactly. Because of the risks to pets and also wildlife, like owls eating poisoned rats, that kind of secondary poisoning regulators, particularly in the U.S., restricted the sale of many SGR products directly to consumers a few years back.
So you can't just buy the super potent ones at the hardware store anymore.
Generally not in the same forms, like loose pellets for consumers. They're now mostly limited to professional pest control operators who are supposed to use them in tamper-resistant bait stations. But exposures in pets still happen all the time. They might get into the stations or find improperly discarded bait.
Still a risk out there.
Definitely. And an interesting side note, the Poison Control Center has actually reported an increase in exposures to other types of rodent poisons, like bromethalin, which is a neurotoxin, after the SGI restrictions went into effect. So, the problem doesn't entirely go away. It sometimes just shifts.
Huh? Good point. Okay, so we understand the mechanism blocking vitamin K recycling and that the type matters hugely for potency and treatment length. Let's talk signs. What should people be looking for, keeping that 3 to 7 day delay firmly in mind?
Right, that delay is everything. Remember, if you think they ate it, call the vet before signs appear. Don't wait.
Okay, message received. But if signs do start, what are the subtle early ones?
Often it's really nonspecific at first, just tired, lethargic, not really wanting to eat, maybe acting a bit weak. Pale gums, that's a big one. It's a direct sign of anemia from blood loss.
Okay.
You might also notice they're breathing faster or it looks like more effort to breathe. That can signal bleeding inside the chest cavity.
And then comes the more obvious, scary stuff.
Yeah, then you might see actual visible bleeding. Things like petechiae, tiny little red dots like pinpricks on the skin or gums, or ecchymoses, which are bigger like bruises or splotches. Check areas with thin skin like the belly or ears, and definitely look in their mouth.
What about bleeding from, openings?
Yes, that's common too. Nosebleeds, that's epistaxis, bleeding from the gums, gingival bleeding, blood in the vomit, hematomas. Sometimes that looks like coffee grounds if it's partly digested. Dark, tarry stools, that's called melena, means digested blood from higher up. Or fresh, red blood in the stool, hematochezia. Blood in the urine, hematuria. Even coughing up blood, hemoptysis.
That sounds absolutely terrifying.
Yeah.
What about the bleeding you can't easily see, internal bleeding?
Right, and that's often just as, or even more, dangerous because it's hidden initially. Bleeding into the chest cavity, the hemothorax we mentioned, causes serious breathing problems. Bleeding into the abdomen, hemoabdomen, can make the belly look swollen and feel painful.
Okay.
Bleeding into joints, hemarthrosis, causes sudden severe lameness, just totally unwilling to bear weight on a leg. Bleeding into the sac around the heart, hemopericardium, squeezes the heart. Bleeding behind the eye, retrobulbar hemorrhage, can make the eye bulge out. And the really bad one is bleeding into the brain or spinal cord, CNS hemorrhage. That causes neurological signs and has a very poor prognosis.
So basically anywhere. It can bleed anywhere.
Pretty much anywhere, yeah. Because a fundamental problem, the inability to clot, is body-wide. And if the blood loss gets severe enough, you'll see signs of shock. Really fast heart rate, weak pulses, those pale gums again, maybe a low body temperature. It's interesting, actually. Historical data from poison control suggests that respiratory signs, coughing, difficulty breathing, were often the very first things owners reported noticing.
Suggesting chest bleeding might be a common early spot.
It seems that way, yeah. Often one of the first major sites.
Okay, so subtle weakness, pale gums, faster breathing, weird bruises, obvious bleeding from anywhere, or sudden lameness, maybe a swollen belly. Huge red flags, especially if there's any chance of exposure days before.
Yeah.
How does the vet figure out for sure that this is what's going on?
Diagnosis always starts with a really good history. This is where you, the owner, play a critical role. Did you put out bait? Did your neighbor pest control visit recently? Did the dog maybe eat a dead mouse? If you have the package, bring it. Knowing when it might have happened is also vital because of that delay.
Right, the timing tells the vet when tests might become positive.
Exactly. Then comes the physical exam. The vet's looking for all those signs we just talked about: paleness, bruises, breathing effort, signs of shock. But the definitive diagnosis comes from blood tests, specifically coagulation testing.
The PT and APTT tests you mentioned.
Yep. Prothrombin time, PT, is the star here. It's the most sensitive test and usually the first one to become abnormal. Because it measures factor VII activity, and factor VII has that short half-life, the PT is often prolonged within 24 to 48 hours after ingestion.
Even before the animal looks sick.
Even before they look sick. The activated partial thromboplastin time, APTT, checks other factors and will also get prolonged, usually a bit after the PT. There's also an in-clinic test called activated clotting time, ACT, but it's less sensitive, takes more severe factor depletion to show up.
So if I call my vet, because I think my dog ate bait yesterday, even if he looks fine today, they might say come in tomorrow or the next day for a PT test.
That's a very common and appropriate plan. Checking that PT at 48 to 72 hours post-suspected ingestion in an animal with no symptoms is key. It tells us if prophylactic vitamin K1 treatment is needed.
And what if that test is normal at 72 hours?
Well, if it was likely an FGAR, a first-gen poison, a normal PT at 72 hours usually means they dodged the bullet and treatment isn't needed. But for SGRs, the super warfarins, because they last so long, even a normal PT at 72 hours might not be completely reassuring, especially if a large dose was suspected. The vet might still recommend monitoring closely or even a short, cautious course of vitamin K1 just to be safe.
Makes sense. What other tests are useful?
A CBC, complete blood count, is standard. We check for anemia, low red blood cells due to the bleeding. And here's a really important clue: the platelet count.
Platelets, what about them?
With anticoagulant rodenticide poisoning, the platelet count is typically normal, or maybe only mildly low, say 50,000 to 150,000. This is a huge help in distinguishing it from other bleeding disorders like immune-mediated thrombocytopenia, or IMT, where the main problem is the immune system destroying platelets, so the count is usually drastically, dangerously low.
So normal platelets points towards AR poisoning if there's bleeding and prolonged clotting times.
Exactly. It's a key differentiator. Imaging, too, like chest x-rays or an abdominal ultrasound, can be really important to find hidden bleeding, that hemothorax or hemoabdomen, especially if the exam suggests it.
Okay, diagnosis confirmed. Now for the treatment, the life-saving part.
Absolutely. And it needs to be prompt, it needs to be aggressive, especially if bleeding has already started. Now, if the ingestion was very recent, like within maybe an hour or two, maybe up to 4 or even 8 hours for those slow-dissolving wax blocks, and the animal is stable and not showing signs yet,
All right.
then decontamination might be an option. That usually means making them vomit and giving activated charcoal to bind up any poison still in the gut. Sometimes multiple doses of charcoal for big ingestions or the long-lasting SGRs.
Try to get it out before it's absorbed.
That's the goal. But once they're actually showing signs of bleeding, decontamination is generally too late and potentially risky. The focus then shifts entirely to the antidote.
Which is vitamin K1.
Vitamin K1, also called phytonadione. That's the specific antidote.
How does it work again? Why is it the antidote?
It works because it is vitamin K. It provides the raw material the liver needs to start making functional clotting factors again. It essentially floods the system, bypassing the block created by the poison on the VKR recycling enzyme. It gives the liver what it needs to resume production of factors 2, 7, 9, X, and X.
Okay, so how do you give it? Pills? Shots?
The preferred way is orally, by mouth, whenever possible. It actually absorbs better if you give it with a fatty meal.
Interesting. Fatty meal helps.
Yep. Now, if the pet is vomiting, has significant bleeding into the stomach or intestines, or is just too unstable, it can be given by injection under the skin subcutaneous, or SC. Usually, they use a small needle and give it in several small spots to reduce the chance of causing bleeding or a lump at the injection site.
Okay.
One really critical point. You absolutely want to avoid giving vitamin K1 intravenously, IV. There's a known risk of a severe, potentially fatal allergic type reaction, an anaphylactoid reaction when given IV. So oral or SC only.
Oral or under the skin. Got it. Very important. What about the dose, and especially how long they need it? You stressed that duration difference earlier.
Dose is typically around 2.5 to 5 milligrams per kilogram of body weight, usually once or twice a day. But yes, the duration is everything. It's dictated by the type of poison. For FGARs, first gen, about 2 hits of treatment is usually enough.
Okay.
But for SGRs, the super warfarins, because they hang around so much longer, you're looking at 3 to 4 weeks minimum. Sometimes, like we said, even 4 to 6 weeks or occasionally longer for massive ingestions.
And just to hammer this home, even if the dog seems totally normal after, say, a week on vitamin K1, you absolutely must continue for the full prescribed course.
Absolutely. Positively non-negotiable. Stopping early is the single most common reason for fatal relapse. They might look fine because the vitamin K1 is working, but the poison is still there, still blocking the natural recycling. Take away the antidote too soon, and the bleeding starts again.
Right. Okay, so how does the vet know for sure when it's safe to stop?
Great question. So after they finish the full prescribed course, say 2 weeks for an FGAR or 4 weeks for an SGAR, the vet will have you stop the vitamin K1. Then about 48 to 72 hours after that last dose.
Okay, wait a couple of days.
Exactly. Wait 2 to 3 days off the medication. Then you bring the pet back in to recheck the PT, the prothrombin time. This test tells us if the body's own clotting system can now function normally without the supplemental vitamin K1.
Testing their natural ability again.
Precisely. If the PT is normal at that 48, 72-hour recheck, great. They're usually good to go. If the PT is still prolonged, it means the poison is still having an effect, and they need more vitamin K1. Usually another 1 to 3 weeks, followed by another PT recheck 48, 72 hours after that course finishes.
Makes total sense. Test, treat if needed, retest. What about pets that come in already in crisis, bleeding badly?
Yeah, if they're actively hemorrhaging or severely anemic, they often need blood transfusions immediately. Products like fresh frozen plasma, FFP, or whole blood provide instant clotting factors to help stop the bleeding right now. If the main issue is just severe anemia, packed red blood cells, PRBCs, are given to boost their oxygen carrying capacity.
And other supportive stuff.
Sure. 5E fluids are crucial if they're in shock from blood loss, oxygen therapy if they have trouble breathing from chest bleeding or anemia. And, cannot stress this enough, strict cage rest, absolutely minimal activity. Any exertion can trigger or worsen bleeding when clotting is impaired.
Keep them quiet.
Very quiet. Pain relief if needed, maybe stomach protectants if there's GI bleeding. Sometimes, if there's a huge amount of blood in the chest or abdomen that's life-threateningly compromising breathing or circulation, they might need to drain it thoracocentesis or abdominocentesis. But ideally, you give FFP first or concurrently to help stop it from just filling back up. Oh, an important note. Vitamin K3, another form sometimes found in supplements, is totally ineffective for this and should never be used.
Only vitamin K1. Got it.
And just generally minimizing stress, avoiding unnecessary needle pokes or procedures is important too because of that bleeding tendency.
Okay, so it's intensive treatment if they're critical, but the antidote works well if given correctly and long enough. What's the overall outlook, the prognosis?
You know, the good news is the prognosis is generally good to excellent if it's caught reasonably early and treated appropriately, especially meaning completing that full course of vitamin K1. Many animals show dramatic improvement pretty quickly, often within 24 to 48 hours of starting the vitamin K1.
That's encouraging, but I assume there are cases where it doesn't go so well.
Definitely. The prognosis gets much more guarded or even poor if diagnosis and treatment are delayed significantly, or if there's already been severe bleeding into critical places like the brain, the lungs, or around the heart. And repeating this one more time because it's so important, if the owner doesn't complete the full treatment course leading to relapse, that often has a much worse outcome the second time around.
Which just brings us back around to prevention being absolutely the best medicine here.
Prevention is everything. Seriously. Educate yourself, your family, your neighbors if you can. The absolute safest thing is just don't use these anticoagulant baits around pets, period. If you feel you must use them, store them like they're, well, poison,
Yeah.
locked away, zero chance of access.
Right.
Only use proper tamper-resistant bait stations that are actually designed to keep pets and kids out. Supervise pets closely when they're outside, especially if you know neighbors use bait or if you're near agricultural areas. And try to discourage them from hunting or scavenging rodents because of that risk of secondary poisoning.
Makes sense. And the single most important prevention tip, if you suspect anything.
Call your vet or a pet poison control hotline immediately. Don't wait. Even if your pet looks completely fine, just saying, hey, I think my dog might have eaten some mouse bait about an hour ago, lets the vet guide you. They can tell you if making them vomit is a good idea or advise you on setting up that crucial PT test in a couple of days. Early intervention before bleeding starts is always safer, less stressful, and much less expensive than treating a full-blown crisis. And bring the box or package if you have it.
Crucial advice. Okay, so let's quickly recap this deep dive. Anticoagulant rodenticide poisoning, it's sneaky because the signs are delayed, sometimes for days.
Right. The VKR enzyme block takes time to deplete clotting factors.
Exactly. The type of poison, first-gen versus second-gen super warfarin, dramatically changes how long treatment needs to last.
Longer duration for SGRs, absolutely critical.
Vitamin K1 is the life-saving antidote, given orally or under the skin, never IV. And completing that full, sometimes multi-week course plus strict rest is non-negotiable for a good outcome.
And while treatment works well if done right, prevention is key. Avoid the baits if possible, secure storage, use proper stations, supervise pets.
And call the vet immediately on suspicion. Don't wait for signs.
That's the core message.
Okay, so here's a final thought for you to chew on. We just talked about how common household products designed for one thing killing rodents can have this serious delayed system-wide effect on our pets by disrupting a fundamental process like the vitamin K cycle. Makes you wonder, doesn't it? What other, maybe more subtle environmental things, chemicals, products, exposures might be affecting the long-term health of our pets or even us in ways we just don't fully appreciate yet? Maybe because the effects aren't immediate but build up slowly or only show up down the road. Something to think about as you look at the world around your pets and yourself.